Are you caring for someone and worried that they might have dementia and need to know about all the tests to determine a dementia diagnosis? Let me break it down for you so you know exactly what to expect and how these tests actually work. First, the most common starting point is the cognitive screening tests. These are quick, simple questions or tasks that give doctors a snapshot of how someone's brain is working. The Mini Mental State Examination, or MMSE, is one of the classics. There are different versions of these tests, which have different names. The Mini Mental State Examination, MMSE, used to be the most commonly used test. In this test, the person might be asked to remember a short list of words, name everyday objects, or even draw a simple shape like a clock. It's not about passing or failing, but about finding clues that could signal memory or thinking problems. Another test is the Montreal Cognitive Assessment, MoCA for short. There are different versions of these tests, which have different names. Other versions of this test or assessment are called the ACE-3. These tests have slightly different questions, but are all designed to check your mental abilities in the same way. This one's a bit more detailed. It checks things like attention, memory, language skills, and even the ability to switch from one task to another. It might involve copying a drawing, repeating sentences, or listing as many words as possible that begin with a certain letter. Again, it's all about spotting early signs that something could be off. But it doesn't stop there. Doctors also use blood tests to rule out other causes of memory loss, like vitamin deficiencies or thyroid problems. And other scans like CT scans can check for signs of stroke or a brain tumor. But they cannot provide detailed information about the structure of the brain. MRI scans can help confirm the type of disease causing a person's dementia. It can do this by showing if blood vessels are damaged, which happens in vascular dementia, which parts of the brain are shrinking, getting smaller. This helps find out which type of dementia a person has, as different diseases that cause dementia affect different parts of the brain. The MRI machine can be very loud, so you may be offered earplugs. You will also have to stay as still as you can. If you are uncomfortable with loud noises or have trouble staying still, you should discuss this with your doctor before your appointment. SPECT or PET scan. If the result of your MRI or CT scan is not clear, you may have another type of scan called a SPECT scan or a PET scan. These scans can show if there are problems with the blood flow in the brain. DAT scan. If the specialist thinks you could have dementia with Lewy bodies or Parkinson's disease dementia, you may have a scan of the brain called a DAT scan. These scans involve the injection of liquid and special scanning equipment that can look at how the brain is working, rather than what it looks like. If you're feeling nervous about these tests, you're not alone. It's totally normal. But knowing what to expect can make things a little less scary and might even help you support your loved one better through the process. So if you notice changes in memory, confusion, or personality, reach out to a doctor and ask about these assessments. Early testing means early support, and that can make all the difference. If you're caring for someone that has dementia, see the online course titled Being a Dementia Caregiver on udemy.com.